Good morning, Bhoomi. It's such a nice pleasure to be here. We're in this amazing building, and I'm very excited to sit with you. So first, let me tell everybody who you are. Dr. Bhoomi Mehrotra, with a ton of titles around cancer services here at Catholic Health. Give me a list of those titles.
Well, Jay, it's very kind of you, and thank you for having me here this morning. I'm the chair of Cancer Services for Catholic Health. I also have the pleasure of being the director of the Cancer Institute at St. Francis, and I lead the oncology department at St. Francis. It's not about titles, it's really about the pleasure of working here with my colleagues who have allowed me to have this amazing journey, be able to build this program across our health system.
When you look at that leadership and that role you play now, obviously you don't just step into this outside of medical school like we're just talking about your daughter. Tell me, how'd you get here? You know, what put you at Catholic Health in these days?
It's really interesting. I was at a different institution, different health system, a few miles down the block, had worked there for almost 20 years. I was driving down one night going home. I got a call from Dr. Gersey, who was our previous CEO. And I thought he had dialed the wrong number because at that time he was the head of St. Francis Hospital. And I told him when I drive down Port Washington Boulevard, hey, it says the Heart Center. I said, you got the wrong guy. So he said, no, just listen, talk to me. And I think it had something to do with our chairman of surgery, Dr. Gesselter, who he had recruited a few years ago, who thought that St. Francis had the right atmosphere for a cancer institute, for a cancer program. And I said, so what does one need for a successful journey for a cancer-affected individual? The high-quality medicine and that compassion. And so I thought it was a natural, really, marriage between the two that could be developed at St. Francis and at large at Catholic Health. And fast forward 11 years, I really feel that was the best thing ever.
Oh, it's amazing. I wish I could bottle what you just described. You know, we are trying to spread that through the organization. And we're seeing tremendous gravitation to that, you know, that compassion, clinical excellence, the love. I love how you put that. We spoke with Dr. Gesselter a few weeks ago, and he told a similar story. He said, you know, we got to get this guy. Well, we're so happy to have you. I mean, it's made a tremendous difference, and I agree. When you look at St. Francis, it's not just the Heart Center anymore. It's still incredible.
Yes.
But now we're incredible on so many fronts, as recently seen in U.S. News.
To go along with that part of the Heart Center, which I think is critical part of our cancer institutes, is we recognize the demographics of our population. As we age, there are two things that are highest mortality reasons: heart disease and cancer. And the two often coexist. And one makes the management of the other much harder. The greatest part of being part of the team here is you pick up the phone, you call our cardiology colleagues for that individual. We actually have a cardio-oncology program, which is dedicated. And I can reach out to Rich Schlafmitz. His words to me are, Bhoomi, you take care of the cancer, I'll handle the heart. And you know how reassuring those words are, not just to the oncology team, but also to the patient.
I agree.
That my doctors talk to each other. They know my limitations, they know my challenges, and they are going to figure out the best path forward for me.
You certainly describe this incredibleness that you helped develop, you know, helped bring to the forefront of St. Francis. But now we're doing that at the system level. So in your role as the chairperson for the system, what does cancer care look like across the system?
Yeah, so it's developing. And we have two major hubs. One is in Suffolk County at Good Samaritan University Hospital, where we have a fabulous new facility, similar to what is at St. Francis. We have two other smaller hubs, I would say satellites, at Mercy and St. Joe's. They're all part of our Cancer Institute. They all have access to entire spectrum of cancer services, from screening to diagnosis to therapeutics to participation now in clinical trials.
They're going to get the same level of
They're
care.
going to get the level of expertise and depth of knowledge and experience.
And compassion. I love that.
And the
I look at
compassion.
compassion as the verb for
Yes.
empathy. You know, it's how we
Absolutely.
execute empathy,
Yeah.
which certainly, you know, we spend a ton of time working on. Let's talk about clinical trials. You brought that up earlier. I know we have a relationship with an incredible cancer institute upstate. Tell us about.
Yeah, that's very exciting, Jay, and I know you've been part of that, and thank you for facilitating it. Roswell Park Comprehensive Cancer Institute is the national comprehensive cancer institute in upstate New York. They are excellent partners for us with clinical research. We have been able to now open clinical trials through the National Cancer Institute by going through their research offices and becoming an affiliate for research purposes. That is access to clinical trials that are through the National Cancer Institute. The other part is Roswell itself has its own proprietary trials. So they have, for example, a vaccine trial that supplements immunotherapy.
For what kind of cancers?
So lung cancer, for head and neck cancer. So we are expanding the access to those institutional proprietary trials. And then we also have relationships with them. We almost use them as oftentimes to come in and do an audit, a quality audit, for example, as an external institution. And fortunately, all our sites have really done amazingly, and they're impressed how a community cancer program has this level of excellence.
You're alluding to this. What does the next 5 or 10 years look like for cancer care here at Catholic Health?
Yeah, so I think it's going to be more of personalization. Every individual's tumor, even though it may be arising from a different tissue site, it's going to be dependent on the DNA, the molecular signature. There are tumors today, Jay, that arise from close to the pancreas or from the gut or from a different tissue organ, maybe the lung. But if they have similar signature of, for example, something called microsatellite instability, that means the tumor DNA is so unstable that you can exploit it by treating those patients with immunotherapy to stimulate the immune system from the own individual person to attack the tumor cells.
That's a new one for me. Microsatellite
Instability.
I love that.
So
that's 2 terms I have for me now.
So those individuals, there are now studies that folks with rectal cancer who have microsatellite instability, these would previously have been treated with radiation, chemotherapy, and surgery, possibly spending the rest of their lives with a colostomy bag, can be cured with immunotherapy.
Yeah, very important.
You know, the goal is to get folks to survivorship.
Absolutely.
And survivorship is not just that the cancer was operated on and is gone. It is about oftentimes living with cancer and coming back into the mainstream of life and being part of the social matrix again. That's what it is all about. And we have more and more people that are on some kind of maintenance therapy. They see their doctors periodically, but they are
becoming a chronic disease as opposed to.
Yes.
Well said. You know about my personal experience with this disease, and for my wife, who is thankfully cured. Knock on wood, for us to go and run a marathon, to celebrate our 10-year anniversary is pretty amazing. So you can't just work, right? I know you have a beautiful family. What do you do for fun? What do you do to relax?
Yeah.
Are you a couch Netflix guy? Are you? No. I'm in the gym and I'm pounding weights at 6 in the morning.
So neither of those. I have to say, one of the most relaxing things I do is travel with my family to the national parks.
Oh, really?
Yeah.
You got there camping?
Yes.
Glamping? Are you glamping?
Well, we go, last year we went to Acadia. We've gone to Shenandoah, we've gone to the Smoky Mountains, we've gone to Yosemite, we've gone beyond. But it's
And do you camp out, or do you stay? Like,
Oftentimes
in a
in
local hotel and
cabins
do-
or cottages, some in the forest. If we get our act together, it's often hard to align all our calendars, but there are sometimes lovely cabins in the national forests itself. Yeah, that's something we look forward to every year,
that's
and
beautiful.
it's a special thing that we can do as a family, and I think allows me to clear my mind
I
oftentimes.
can only imagine. Yeah, well deserved. Well, listen, this
Thank
has
you.
been a pleasure. What you're doing and leading here is incredible. I know it is about the team,
Yes.
but again, so much is on the leader, and your leadership is a true blessing here at Catholic Health.
Thank you,
So
Jay.
thank you so much for sitting with me and taking the time.
It's my pleasure. Thank you for having me.
Pleasure, as always.
Take care.